Hello, my name's Sarah Pitcher. I'm one of the colorectal cancer clinical nurse specialists at Yeovil. I just want to talk a little bit about the clinical nurse specialist role, the CNS role. We act as key worker to the colorectal cancer patients, and we're your named nurse. We are an easily accessible point of contact, and we offer you continuity of care, and we help to coordinate and oversee your care, and we are an advocate for you within the multidisciplinary team. Our role involves support for you and your family from the point of diagnosis onwards through the cancer journey, and we can be available on the telephone, via email. We will see you in clinic, on the ward, and we can see you in the endoscopy suite. We can provide information on treatment, on side effects for your surgery, your chemotherapy, radiotherapy, your test results, and the cancer pathway. And we can offer specialist advice, specialist knowledge, written information, and we can also help with decision-making support. We're there for your physical and your emotional needs. We can offer you practical advice, symptom control, side effect control, your diet, your medication, and any coping strategies that are appropriate. We can also signpost you to other services, to other specialist support services, onward referral to dietitians, to counsellors, to support groups as appropriate. And using the holistic needs assessment, we can assess your individualised needs, we can adapt according to your changing healthcare needs and individualise your care. Just want to go on to your follow-up. After a cancer diagnosis and treatment, we follow you up for 5 years. And there's 3 real aims in this. The most important being the early detection of any treatable recurrence. Secondly, we want to monitor your recovery. We want to help you to manage any side effects, short-term side effects, long-term side effects, or late side effects. We can help you with that. And finally, we want to encourage good health with healthy eating, exercise, and help you to get your life back on track. So how do we follow you up? There's 3 main ways in which we follow you up. The most common is supported self-management, when we schedule your tests for 5 years and we have an appointment if you need it, so an open appointment. The tests we perform are CT scans of the chest, the abdomen and the pelvis, colonoscopies, and blood test for a CEA marker. And a CEA is a protein that's released by a colorectal cancer into the bloodstream, so we look for that. Just one note on colonoscopies: they are invasive procedures that can carry risk, so they will be performed according to national guidelines, depending on your age, your fitness and your kidney function. So we will come up with a personalised follow-up care plan for you. Other ways we can follow you up are by nurse-led 6 monthly appointments. It's the same scheduled tests as before, but we see people every 6 months, and this might be appropriate for anyone who's frail, who has a lot of other health concerns, a lot of side effects, or who has already had a recurrence and we're watching them more closely. Finally, you can be followed up in the MDT by a consultant surgeon, by a consultant oncologist, and this is according to your needs when you require a little bit more complexity of follow-up. Finally, just a note on follow-up: individual preferences and needs are taken into consideration. Some people choose to only have tests if they become symptomatic. Others are not going to be fit for any more treatment in the future, or don't want any more treatment in the future, in which case we will not do tests unnecessarily. But those are all fine as well. Finally, I just want to talk about the signs and symptoms, what to look out for during your surveillance period. Firstly, bleeding from the back passage, bleeding from the bottom. It might be bright red blood, it might be dark blood, it can be on the toilet paper, in the toilet, might be on the stool, mixed in with the stool, let us know, please. Particularly if it's not related to any pain. Pain can be from a fissure, a tear, or from hemorrhoids, so let us know. It also applies if you have a stoma. If there's bleeding from the stoma in the output into the bag, we would like to know. Not necessarily from round the outside of the stoma, where sore skin often causes a little bit of bleeding. That's quite a common occurrence, but if it's mixed in with the stool and going into the bag. The same applies to mucus. If you see excess mucus or slime, please do let us know. The other things to look out for are change in bowel habit. Particularly if it persists for more than 4 weeks, if it's a looser stool or going to the toilet more often, or if it's alternating constipation with diarrhea, we need to know, or a feeling of incomplete emptying, when you've been to the toilet feeling that you're not completely empty. Any unexplained pain in your tummy, particularly if it's severe pain, may be related to going to the toilet, or it may come and go. It might be crampy, it may be colicky. Please do inform us of that. Any unexpected lump in your tummy, particularly on the right hand side, often it's a hernia, but we would need to review that. If you've lost weight and it's unintentional, you haven't been on a diet, maybe your appetite is poor, you feel full quickly when eating, or you feel nauseated, then please, another thing to let us know about. Unexplained tiredness, breathlessness, short of breath, dizziness. These can all be signs of anemia. Again, we would like to know about that, please. And finally, any signs of jaundice. That might be yellowing of the skin, yellowing of the whites of your eyes, itching of the skin, pale stool, dark urine, temperature, pain in the top right-hand corner of your abdomen. Please do let us know. Now, a lot of these signs can be caused by minor problems, but we would need to review you. We might review you over the phone or in person, and we may need to do some more tests to rule out anything serious. Thank you.